major heroin bust in Northeast Ohio. We first brought you exclusive video of the evidence seized during the raids yesterday. Today, investigators released more information on what they found and who was arrested. 7 people are now in custody, and investigators expect to make more arrests. The seizure of $90,000 worth of heroin is the biggest ever for Lorain County. Investigators say they have been watching the primary suspect, Wayne Norris, since 2012.
It's easy to make low-level buys on individuals in these type of organizations, which doesn't lead to much jail time. It's a whole nother thing to get an investigation going of this magnitude where we can put people in prison for 10 years.
Investigators say Norris was bragging that he would never get caught and say any information people can give them can help get suspects like these off the streets. Lorain's heroin bust prompted questions about what's going on in Cuyahoga County, where officials launched a heroin initiative nearly 2 years ago. News Channel 5's Kristen Volk is live tonight. And Kristen, is that program working?
Chris, the bad news is that heroin is still a huge problem in Cuyahoga County. The Stella Maris Treatment Center here in Cleveland says 75% of its patients are opiate dependent. They just can't keep up with the demand for help. This comes as a key part of the county heroin initiative. The public awareness campaign just wrapped up.
You're talking about a rate that's more than double what it was just a few years ago. So the trend couldn't be worse.
It was September of 2012 when Cuyahoga County Executive Ed Fitzgerald said it was time to tackle the growing heroin problem. So he announced the formation of a county heroin initiative. A big part of the initiative was to curb the number of heroin-related deaths. But fast forward nearly 2 years, and this is what we know.
That impact is not at a measure where I could tell you, Kristen, that we've conquered it. We have a long way to go. We have longer to go.
Bill Denahan is CEO of the Alcohol, Drug Addiction, and Mental Health Board of Cuyahoga County. He is also a part of the County Heroin Initiative. Denahan says the number of heroin deaths in the county hasn't shifted much in recent years. In the first quarter of this year, the county says there were 38 deaths. Last year, there were 47 deaths in the first quarter. And in the first quarter of 2012, there were 41. Drug counselor Ellen Marniella knows about the problem firsthand.
We have a waiting list for people to get into the detox unit.
That waiting list is a month long. Marniella has worked at the Stella Maris Treatment Center in Cleveland for the past 31 years. And she's surprised to see just how much heroin has ravaged so many lives.
We're seeing a lot of white, Caucasian females and males young.
The shortage is funding.
Dennis Madden is the director at Stella Maris. He says the initiative has done a good job at making people aware of the problem and educating them about the dangers of heroin. But long-term residential treatment for addicts is crucial to recovery. Denahan agrees. He says he's committed to getting ahead of this problem that has plagued our community.
This is the deadliest experience anybody's going to have.
The public awareness phase of this initiative cost $400,000. County officials tell me that they are putting $200,000 of tax money toward more residential beds for addicts in the next couple of months. On your side in Cleveland, I'm Kristen Volk, News Channel 5.